Hi, this is Christina Brown, and I'm William Frye, and we're going to present on the advanced nursing degree of being a midwife.
So first we want to talk about what is a certified nurse midwife. So it's an advanced practice nurse that assists with low-risk births, offers counseling, ensures health of woman and baby. This particular nurse practitioner gives side-by-side care. She is with the woman through her pregnancy journey, helps her tailor her pregnancy experience, remains in contact with her even postpartum, and we want to reiterate that this is for only low-risk pregnancies. Any predisposed conditions such as diabetes, hypertension, previous high-risk pregnancies, those are all things that would defer you to go straight to an OBGYN, because that is outside of a certified nurse midwife scope. So why be a certified nurse midwife? Projected openings will grow 29% between 2012 and 2022. This secured you a position. We are in the midst of those years. A national average annual wage in 2018 reported roughly around $107,000. That's a comfortable living. Help provided a personal and safe alternative to mother for birthing experiences. This is a reason why we go into nursing care, is to give people the best care we can, make them feel important, make them feel involved in their care, and to put a smile on their face.
There are several steps to becoming a nurse midwife. First, you need to get your nursing degree and then pass the state boards or the NCLEX. And if that degree did not include the bachelor's, you'll have to go back and get your bachelor's in nursing as well. Once that's done, you'll have to sign up and get accepted to master's level nursing classes. And once you pass those, you sit for a state test with the American Midwifery Certification Board. And once you're certified, every 5 years you'll have to either retake that test for $500 or sign up and take 3 training courses as well as 20 continuing education classes, 20 hours. There is a shortage of nursing midwives. Right now, roughly 56% of all counties in the United States don't have a certified nurse midwife in it. This fact, combined with an increasing female population that is supposed to increase by 18% by the year 2030, and an annual birth rate that is supposed to increase by 100,000 births annually, also by the year 2030, is increasing the shortage. A study in the Midwest that reviewed over 1,400 low-risk midwife charts after birth and compared them with OBGYN charts found that the midwife's outcomes were better. They had less hospital stays, less complication, and used less invasive measures such as C-section and vacuum assist when delivering. This compared. The role of the midwife is also not well embraced in the United States as in Europe, which leads us to have much higher death rates, roughly 18.5 deaths per 100,000 births in the US. The outcome and the economic slides kind of go hand in hand. Due to the less invasive procedures, the shorter hospital stays all lead to better outcomes and less cost for the patients. With reform, the increased need for maternal care is increasing with the population, combined with more women seeing doctors due to the passing of the Affordable Care Act, has led some states to look at their laws about how midwives can practice. States such as California and North Carolina are beginning to adopt a program where the midwife doesn't have to practice under a doctor, but can practice by themselves and stand alone. This is trying to encourage more nurses to become midwives as the need for it increases.
So next we're going to talk about evidence-based practice. This is something that we use throughout all nursing. Certified midwives have a midwifery digest. This is a journal that's put out every month. It commonly refers to new updated policies, procedures, also keeps midwives current with the news, legislation, healthcare reforms that are happening in their world. Midwives are constantly integrating best research, clinical expertise, and incorporating patient values and making decisions for each individual care. Midwifery is as old as time. It started in the 1920s, but it is ever changing now that we're incorporating more evidence-based practice and recognizing it for the need that we have for it. Every mother is very different, so it's tailored to them. So that also means that it's ever changing. Research has shown cutting a female for an episiotomy is actually more harmful than beneficial. This is research based off of midwife evidence-based practice. They found that there are hidden consequences for women's long-term health in terms of discomfort, sexual and psychological long-term problems, and of course increasing trauma when there's no need for it. These are all things that have taken episiotomies out of the midwife birthing centers and is trickling into the hospital setting as well. So legal issues. Malpractice insurance is a necessity when becoming a nurse practitioner, and certified nurse midwifery is no different. It protects your license. Patients, insurance companies, and patients' families sue under the claim that there was harm by saying the nurse midwife is negligent or causing intentional harm. Malpractice insurance saves you from those things, prevents that from being detrimental to everything you work so hard for. Malpractice insurance is more than likely going to be provided to you by the physician that you work under, and then oftentimes you are advised to get your own on top of that. Depending on the years of experience that you have as a certified nurse midwife, anywhere between $5,000 and $20,000 is a good gap for insurance to keep you from losing your license for something. Scope of practice. Most certified nurse midwives are under the Board of Nursing. Florida in particular recognizes certified nurse midwives under the Board of Nursing. Other states have a Board of Midwifery and also a Board of Medicine that they will recognize you under. New legal issues that have come to pass within the last year. Senate Bill 510. This was signed by Governor Rick Scott in 2018. This legislation provided requirements for the reporting of adverse incidents on a form for planned out-of-hospital births under the Medical Practice Act. This is because there's not a lot of research on nursing outcomes, patient outcomes, when a certified nurse midwife is chosen for birth, and then the birthing centers. So we want to collect data in order to make a safer practice and make it safer for our patients. So you want to report it within 15 days. There's a form that's filled out. Adverse reactions include maternal death that occurs in delivery or within 42 days after delivery, transfer of mother to a hospital ICU, patients that may have hemorrhagic shock requiring more than 4 units of blood, transfer of a newborn to a neonatal ICU. Those are all things that you want to report within 15 days because, again, they're trying to build the research data, making sure that the patients and the babies are safe in this practice. So quality of care, the most important thing here is that it expands access to high quality of care being a certified nurse practitioner. We talked about earlier the gap that there is out there of OBGYNs and the ever-growing female population that are having babies. It's hard for them to keep up and give them the quality of care that they deserve and need. Certified nurse midwives are bridging that gap. A review from Cochrane in 2009 summarizes 11 trials involving 12,000 women that took place in 4 countries. It basically says women were less likely to experience antenatal hospitalization, the use of instrumental delivery, and likely to experience spontaneous vaginal birth, feeling in control of their labor experience, All of this is best for mother-baby. They have someone there from start to finish. Even after they have their newborn, they have someone to help them through postpartum stages. Mother is overall more satisfied, feeling in control of her labor experience, and having established somebody there for her from beginning to end, as well as postpartum. Any questions that you may have on breastfeeding, there's a higher success rate for breastfeeding when choosing a certified nurse midwife.
In conclusion, this presentation has shown that there is a increasing demand for the role of midwife, and when a midwife is used for the birthing process, complications are lessened, hospital stays are shortened, and it's better overall outcome for the patient. Thank you.
So become a certified nurse midwife.